All right. Hello, folks, and welcome to day 4 in our clinical summit week. These days kind of feel short, but then it also feels extremely long when I'm like, wow, we're just getting to day 4, just starting off, and then we still have all the fun today and tomorrow. If you are just happening to tune in for the first time, let me know in the chat if there's somehow some way that you're just tuning in on day 4 for the first time. That's totally fine. If you don't know me, my name is Evan Transu. I go by Detective Ev here, though, like Health Detective Ev, not a police detective, although that would be pretty cool. I had 7 different health conditions at the age of 18, all diagnosed by medical professionals, and then going through the FDN system allowed me to get healthy enough that I no longer meet the diagnostic criteria for any of those things. Now I have the privilege of getting to host the podcast at FDN and amazing events like this. It's so cool to see the chat blow up before we even started today and how many people have been on for all the sessions. I'm always incredibly impressed when someone is able to do that. I want to keep the formalities as short as possible today to give our guest as much time to present as possible. So here we go. Remember, we are doing another advanced course giveaway today at 4 o'clock Eastern. How do you enter? You enter between 11 a.m. Eastern and 3 p.m. Eastern. So we are 5 minutes past 11. You have 3 hours and 55 minutes to enter. Many of you wonderful people yesterday were saying, how do I post to my story? That is something that you could look up on Google, but I promised I would show you today. I'm going to do it very quick. All I did here was open up my Facebook app, and you'll see, well, not a lot of stuff, but the wonderful Benazati's on there. Right in the top left corner, as soon as I opened up my app, it's just in the top left on the home screen. I click Create Story, and I can post from these funny photos. This was a Meta AI made me a classical AI image last night that looks ridiculous. But what you're going to do instead is you're able to take a photo here with your camera. So you take the photo, you click it, you post it to your story, and you tag at FDN Training or at Functional Diagnostic Nutrition. You do that in the next 3 hours and 54 minutes, then you are good to go, and we will do the drawing today at 4. If you miss out on being in that 4-hour window today, you are still in the drawing for tomorrow. We're putting everyone that entered all week into our drawing for Friday, which is $1,000 advanced course. It's not $1,000 value. We're saying that we actually charge $1,000 for it normally, and we will be giving it away tomorrow on Friday, 4 o'clock Eastern. So that'll be great. The one other drawing that we have not solidified yet, but I promised you guys we would do it, is if we hit 6,000 YouTube subscribers by the end of the week, I'm doing a bonus advanced course giveaway. We're just doing it live on here. So whoever is on tomorrow at 4 o'clock Eastern, we will be doing a live drawing just based off people in the comments. So you guys have done great. I think we're sitting at like 5,700 subscribers on YouTube. Make sure to subscribe. You are watching this on YouTube. So all you got to do is go below this video, click subscribe, and that'll help us get to that 6,000 mark. All right, I'll cover some more housekeeping later, but for now, I want to bring in our guest. That is not our guest. That's an overlay. Hey, Dr. Guy, how are you?
Hi, good. Thanks for having me.
Awesome. We appreciate you being here with us for Clinical Summit Week. And as I told you beforehand, I'm going to bring up your slides here just to make sure that they're all looking good and you can get them moving. Feel free to mess around with them while I read your bio, and we will get right into this. So his talk title is The Future of Hormone Testing, Applying Technology with EndoAxis and the Dutch Test for Enhanced Clinical Outcomes. So I know you guys love the Dutch. This is going to be a cool talk. Let me know if you use the Dutch currently in the chat, or if you're planning on using it in the future. Please let me know that in the chat. So Dr. Guy is the owner of Citron Wellness, a premier naturopathic clinic in Beverly Hills, offering the latest in hormone, gut, and regenerative medicine. Dr. Citron is the chief medical officer and co-founded EndoAxis with the goal of helping doctors understand hormonal dysfunction on a deeper level and offering more targeted therapeutic options. Dr. Guy comes from a background prior to medicine in information systems and software engineering, and conceived EndoAxis to help doctors streamline the thought process behind hormonal dysfunctions and create solutions that are more targeted and custom. Dr. Guy is a member of the Endocrinology Association of Naturopathic Physicians, the California Naturopathic Doctors Association, and previously spoke nationally for Microbiome Labs on gut health. So again, guys, unfortunately, it's one of our lesser credentialed guests. I hope that he's okay for a presenter. So obviously, I'm kidding. We're super glad to have you here. Is everything looking good with your slides?
Everything's great. Thanks for having me.
Thank you for letting me get through my spiel then. I'm going to shut up and remove my head. I'm always here if you need anything, but the floor is yours, my friend.
Okay, great. Well, hi, everybody. Depending on where you are in the country, good morning or start of your afternoon. I am thrilled to be here. I presented at the HIX event last year. The FDNs, we're about this concept has taken us about 5 years to build, but we have been live for approximately a year. And I can say that there's been a lot of FDNs that have been using us, and we're super happy to present today and also to support the community. So let's get started. So EndoAxis, what is EndoAxis? So EndoAxis is a technology platform and allows doctors to upload your Dutch test, and then you get a full patient-specific report and a targeted supplement recommendation. So what's the origin story? Ultimately, what happened was I was relatively sick with COVID. It's kind of a funny story. I was relatively sick with COVID, and I thought I may not be able to work again. As a history of having being a software engineer, I decided, like, what can I create that'll be an algorithm? This is before AI. This is 2020. That'll help streamline processes, because I was that. So 2 days later, I was back on my feet, and then this concept didn't really leave my head. And so what's happened since is that a lot of people have now stepped in to support this movement, and we've been in heavy development for quite some time. And the whole concept is to help streamline the process for understanding hormonal dysfunction, and more importantly, how to fix it. So basically, you log into the system. I have to say that we're entering everybody into a raffle. We'll probably mention it at the end. If you don't have an account, we'll list the link. You can sign up for free. The platform is free. And if you type in FDN conference, everybody who enters in today, we're going to send out into a raffle for our top hero products. And we'll probably send out a few of those kits to show you guys how amazing the products are themselves. But if you, we'll put it at the end. You guys can see. So ultimately, the platform, the way it works is you upload your lab. What's even better than that is then you fill out a symptom tracker. And the symptom tracker is really important because the personalized report will mention the symptoms that you track in for your patients and link them into what the labs say, into what the Dutch test says. So you get this personalized report. Typically within 24 hours, you'll get this long report. I'll show you an example of what that looks like. And then you'll also get an individualized treatment plan for that patient. So let me kind of explain a little bit of how we do things. The Dutch test looks at 5 parent hormones: cortisol, DHEA, progesterone, testosterone, and estrogen. And it has 33 hormone metabolites. For those of you who are unfamiliar with the Dutch test or want to learn more about the Dutch, ultimately what happens is these 5 parent hormones in the blood break down to all of these little metabolites. But every single metabolite has actions within the body and tells a story. So what we've decided to do, the way we've decided to kind of create this technology platform, is building a story for you and for your patient in the report that explains this is kind of what's going on. These are the relationships between the metabolites. These are the relationships within the hormones. This is what's happening as a story, ultimately, of what your patient is experiencing and why. So this is pretty unique for a company in our space. We have not seen anybody else kind of tackle dysfunction the way that we are. We've decided to physiologically pattern out all the dysfunctional patterns that exist. And what we've noticed is that there are 236 different dysfunctional female patterns in existence right now based on these relationships. There's 96 dysfunctional patterns for males, and there's 14 dysfunctional patterns for adrenals. So because not all of these 236 patterns have a disease name to them, an easier way to do it is to just list out the pattern itself and what that pattern indicates, and then list out the symptoms and why those patterns are correlated to those symptoms that the patient is experiencing. So the reason that we do urine testing over serum testing, and again, for those of you who don't know what Dutch is, it's mainly a urine spot test. So it's dried urine. You pee on a couple strips through the day. You send them into the lab. Excuse me. Serum means that you're drawing one time during the day. So whatever's going on at that moment where you're drawing your blood, you're kind of getting the story of that particular moment in time. Urine is going to be a much higher average through the day of what's going on, especially when we collect 4 different times, right? So the urine is bioavailable. So that means what is actually passing through the cell, how it broke down to all the metabolites, which you cannot see in blood, and it captures the daily average. So this is why we built everything around the Dutch test, because we find that functionally, in functional medicine, it is probably one of the most accurate tests in existence. Not even in terms of repeating itself, but also in terms of the data it captures. So, and we have no affiliation with Dutch. I do want to mention that our companies are completely separate. We do not work together. We just really support their technology, and we find it incredibly useful. It is very complicated, which is why we built this. So I'll give you an example of what a blood test will show. So if you take a female's progesterone, it can have a variation up to 14 times a day, drastically showing a difference depending on the time you take the test, depending on the time that you take that blood test. So if you average it out, you will get a global number that's much better as a ratio, because and there are even a lot of doctors who they don't even like to do serum testing because they think it's so inaccurate, because these hormones are so transient, meaning they change so often. So this is a daily collection, right? So from a urine, you're going to look at all of these numbers and you're going to average them out to what's truly happening with, for example, progesterone, but all the hormones specifically. So then what we did is we created products. And the other part of the problem is, how do you do targeted therapies for your patient? So even if you're an amazing hormone doctor and you know exactly how to read the Dutch and you know how to differentiate into these 236 dysfunctional patterns for women, what do you do next, right? How do you figure out which product is specific enough for your patient that's going to have a physiological response? And the only way that we've learned to do that is that we've learned to kind of treat the enzyme activity of what's happening behind the scene. And we are low on minerals. So a lot of people say, like, why are the minerals so low? Is because the minerals support the enzyme reaction at low blends, at low quantities. And then the blends have amino acids and herbs, which are going to be our star players to change the physiological expression of what's going on. So we've created a system and we've numbered it out as well, because there's kind of no way we could build 370 products. That would be crazy. So what we had to do was we had to build in a system that allows something called stacking. Stacking means that our products support each other in the physiological discrepancies that we find per test, meaning that a patient might need a bottle and then they might need to stack it with another bottle in order to get that effect. So the only way we could do that is by creating kind of an internal algorithm and then mapping that to the total pattern recognition that our software allows. So these are our custom formulations. Every single formulation we've created, we've used the best ingredients, the best manufacturing principles that we can think of in existence. It's all glass bottles, which is even more beautiful because the glass allows for no plastic leaching. Xenoestrogens are a big problem in hormones, right? We cannot have our bottles leaching plastic depending on where they're stored and what's going on. So glass contain no light. They're light protective. They're beautiful. And also, even more importantly, every single ingredient is within the target range of therapeutic dosing, meaning that you are going to get exactly what your patient needs at the therapeutic level that all the research applies for. And this was incredibly challenging to build because we had to figure out a system to fix all 236 dysfunctional patterns and all 96 dysfunctional male patterns. But what I can tell you is it's beautiful and it's working. We're getting crazy feedback. The product review, and this is kind of important for anybody who is starting to use our system is they work in reverse order. And this is really important because a lot of times if you're doing basic blood work testing, so let's just say I take some estrogen, it's very high, right? I'm getting a straight estradiol. I'm not really running the Dutch. I don't know how that's breaking down into metabolites. I don't know the rest of the story, but let's just say I have just a high base estradiol. Typically, it is going to be a phase 3 issue. Doesn't have to be all the time, but phase 3 means how it bypasses into the gut, gets eliminated out properly. Why is it high at the top? It's kind of like if you're draining your tub, you kind of want to look at the drain before you look at the excess water coming out of the sink, right? So we always work from that principle. It's principles of detoxification is the primary way that we work. What we found is that this is a very good system for detoxification of the hormones and also supporting hormone synthesis. So it starts in the gut and it works upstream, right? And we can get that data through the Dutch test, which is even better. So, and you don't want to overdo it, right? Hormones are very sensitive. So you just, it's a very Goldilocks principle. You just want it to be just right. So this is one of the ways that we have shown what's on the marketplace. So let's just say I know my patient is estrogen heavy, right? I want to do an estrogen detox. I know a little bit enough to be dangerous, but I don't really know which product is going to be therapeutically healthy for my patient. So what I'm going to do is I'm going to just type in, I go to FullScript, I type in estrogen detox. There's 761 products. So what we did was we took the top 5 products. I'm showing you the top 2 right here, not to say names, but these are the top 2 products for estrogen detox or in the top 5. And we looked at a couple patients and we saw, okay, so would these therapeutic dosing be right for the patient that we're recommending? And what we found was most of these products are actually really good. They have the right ingredients to them, but the dosing is either too much or too little or not appropriate to fix the physiological dysfunction of the patients that we're seeing. So how do you pick ultimately an estrogen detox product based on either your Dutch or your blood test that you know is going to be accurate? And that is the second solve of our company. So one is telling you ultimately this is what's wrong. And then the second part is therapeutically dosing it correctly. And that is a very challenging, but we've solved that problem. And so in this case, we looked at one patient. I'm just going to label out one product for you. We have multiple estrogen detox products, obviously, because depending on who you're talking to, there's multiple ways to kind of do this. But let's just say this patient. We had one patient, and they had a really bad phase 2, phase 3 detox pathway, right? So everything was built upstream, but we did not want to overdo it with them. So when we looked at all the estrogen detox products, we were like, these are going to be those were going to be way too strong. So this is one of what we think is probably one of the more perfect methylation blends, because this will just clean out phase 2 and phase 3. It'll allow the primary estrogen to go to normal because you're kind of cleaning out the drain. So we had a couple formulation experts after we put everything together, actually in the last recent months. And one of the reports that came back was Formula 3. She thought was probably the best methylation product on the market. We were very excited to hear that. It's kind of why I'm highlighting it here, because this product works really well. So the products themselves take a little bit of time to learn. Obviously, there's 26 products and they all do something different. But the system will kind of guide you into what your patient needs, right? Because it's going to be a little too complicated. So that's what we've tried to make it incredibly simple for the practitioner, especially for people who are not hormone experts. So, and then the last thing, and I kind of mentioned this, is the concept of our supplements is new to this space. It's called stacking. So stacking means that our products build on each other. And so for a patient report, what you'll see is product 2, 11, and 14 maybe given. 2 would be our base blend. let's just say 11 would be the like biliary liver blend, and then 19 might be like the cortisol blend, right? So we're addressing the whole system, but we're stacking on each other, and each product supports the other products underneath it. So that's a very interesting new concept. But what we're seeing is every product is creating a better response of the other product. And that's kind of interesting. It's called stacking. So basically what we get with EndoAxis is personalized recommendations. We have probably the most robust help center that I've ever seen in endocrinology. This was one of my dreams in building this company. Was I wanted probably one of the highest levels of support. You get this for free, especially if you sign up today. So if you go to the education center within EndoAxis, you are going to see a breakdown of every single metabolite, every single herb that we use, all the indications of every single hormonal condition, how to work them up with blood and Dutch, like everything. You're going to see everything within endocrinology. It's your true new encyclopedia for everything that you're trying to research. So any condition, any workups, anything, it's all in there. It tells you how we did what we did. It's a very, very robust educational center. If you like research or science, you will geek out. Then we created these custom blends, right, that target the pattern of dysfunction that we talked about. The highest quality sourcing, the best type of ingredients. We use all patented ingredients when we can. It's all top certified, everything stored in glass across the board. And then obviously the assessment and the which is the report, which we're getting to right now. So the report itself is about 8 to 12 pages. So again, you're going to put in your Dutch test. You'll get the report. The report will be specific to your patient. People think because of the length of the report that a lot of that content is static and we're just replicating it report to report. That is not the case. Every single line in that report is custom for your patient. And what we've done was we've created the report in a way that it's based on your expertise of reading the Dutch test. So in the beginning, you will get an overview. You will get a findings report of the big things that you need to pay attention to. So if you're very familiar with Dutch, if you're a good hormone doc or provider, and you know exactly what you're doing, the first 2 pages are kind of all you're going to need. If you want to do a deeper dive into what's happening, the report itself is built in a way where it just allows you to continually read and read and read to really get a very healthy understanding of what's happening with your patient. Again, it's all patient specific. Every single report will look completely different than the next report. And they do bring in the symptoms that you enter that the patient's experiencing. So let's do some case studies. And I want to leave some time at the end for some Q&A. So I'll just show you some examples of some tough cases. These are some of the patients that I've treated, and to show you kind of why, first of all, I'm very happy with what we built and also why it's working really well. But I'll pull out some interesting cases of things that like kind of confused me. And until I had this system, I didn't really know what to do with these patients. So I had a patient, her name was Leah. She came in 39 years old. She told me that she was getting hospitalized every month. For females who know about this, when ovarian cyst rupture, it's incredibly painful. It's debilitating. They typically are rushed to the hospital because it can hurt that bad. There's really nothing you can do about it from a conventional medicine standpoint. So her cycle length was 32 to 34 days. The length of her menses was 5 to 7 days. She'd seen about 5 doctors before she came to see me. Really heavy flow, weight gain, spotting prior to her period, significant PMS for at least 7 days. And then worse than anything, she could deal with all that. But the ovarian cyst ruptures were causing her to go to the hospital. They tried to put her on birth control. It exacerbated her conditions, and she basically couldn't get out of bed. So they went to her and they said, well, we don't know what else to do for you because that's really the only thing conventional medicine doctors typically do, right? If there's a hormonal dysfunction, they try to stop the hormone cascade by providing estrogen or progesterone, hopefully stopping the patient's cycle from occurring at all, if they can stop it altogether, so they don't experience the symptoms. However, in this case, the birth control was completely terrible for this patient. It caused her to go into estrogen dominance. Everything got worse. She got off birth control and then kept going to the hospital, and she didn't know what to do. She came in pretty upset. I ran most of my patients, I do a full blood work panel and I do a Dutch, and I correlate the two. You do not need to do that. Specifically, what we do recommend is doing just blood testosterone. It's always going to be a little bit more accurate. And then our system allows you to type in the blood testosterone, and then it correlates it to what the Dutch testosterone says. So if you're in a position to offer blood testing, we say do the serum. If not, the Dutch test is totally fine by itself, but it's nice to kind of have the two. Either way, for the work that I do comprehensive everything. So I just run everybody through the gamut of full blood work analysis, comprehensive, and a Dutch test, and then I correlate. So everything looked normal in the blood except for serum testosterone. Serum testosterone was a little bit high. We ran the Dutch. I don't know how big this is on your monitor, but we ran the Dutch, and what we saw was this is a testosterone that came back at 0. This testosterone right here in the middle, if you can see my cursor, this testosterone in the middle, this is what's called a UGT mutation. Our system will call it out. 30% or so of the population has this genetic mutation that does not allow them to read a total testosterone in their blood, in their Dutch test. So this is an inaccurate finding of the Dutch. This is a genetic mutation. They do document that in the Dutch test. However, if you miss that, our system will tell you their total testosterone is inaccurate because of this genetic mutation. It doesn't now allow it to read, right? But if you look at the metabolites, that's a better story anyway for testosterone. So total testosterone doesn't really mean much in the Dutch test. The metabolites of testosterone mean much more. Total DHEA, right, is going to be indicative, but it is low, right? So even though her serum testosterone was high, her metabolites are, I didn't see anything here that I was like, this explains cystic rupturing once a month. Your levels are not crazy high. Progesterone relatively in the normal. Estrogen's relatively low if you just look at the fan dials, right? So I was like, okay, well, this doesn't really explain much. I was kind of confused based on when I looked at this test. Methylation is medium. All the ratios look low, healthy, mid-normal, right? So I was like, okay, not really sure what's going on with you. Looked at the cortisol picture. Everything's within range, right? Some of the cortisol metabolites and DHEA are low, but we kind of noted that. Her total metabolized cortisol was low. So I go, okay, let's run your endo report. Let me see what's going on. So it said, with elevated serum testosterone and irregular menstrual cycles reported, irregular meaning that's 32 to 34 days, and sometimes she misses them, there's concern that she fits a PCOS picture. You could have gathered that just from an elevated testosterone, right? However, the metabolites, again, a little abnormal. So I'm going to skip the rest of it because that's just indicating what PCOS means. But the bottom line of that sentence, and this is typically the only paragraph I will read patients, and this is in the first page of the Dutch report, of the EndoAxis report, what this pattern demonstrates. This is a beautiful way to kind of explain the total pattern. Supporting this pattern is targeted towards optimizing estrogen synthesis and follicular health while balancing the androgen or testosterone receptors with herbs and minerals that support aromatase activity. So aromatase activity means the conversion from testosterone to estrogen, right? So this is what we want to do. And this is why I love the report, because it gives you a streamlined kind of approach. This is what needs to happen in order to balance this patient's hormones. Again, the report is very comprehensive. So if that doesn't make sense to you, if you read down, you'll understand everything that it indicates. But typically, if you just read that to a patient, depending on your patient relationships, they're like, great, okay, good. You have a strategy, you know what's going on. So I was happy to kind of hear that. And then one of the findings on page 2 of the report showed a 16-OH elevation, which on the report itself, I missed. And why I kind of glanced over it when I was reading it, I specifically missed it again, is to show you that the fan dials were relatively normal. But what the endo report does that's really amazing is the endo report will show ratios of metabolites to each other and to the parent hormone. And this is stuff that unless you're kind of using calculators in office, you will miss. So it said you have a higher preference for 16-OH in comparison to the other metabolites. We do see a little fan dial on the Dutch report that does indicate that. But in case you were going to glance over that, it said you have a higher preference for 16-OH. And then the reason that this is important is because it can include menstrual headaches, fibroid growth, ovarian and uterine cysts. And when I saw that, I got incredibly excited because I was like, oh, this is beautiful. We finally have a reason your 16-OH is elevated. That is in relationship to ovarian cysts. Now, if you didn't know that, right, you could have, even if you saw that in the fan dial, that percentage rate was higher, you didn't know that 16-OH specifically caused uterine cysts, you would have missed that on this case, right? So I was incredibly excited to hear that. I was like, we finally have a reason. We know exactly what's going on. We know the ratios. We know which products are, we know which patterns of dysfunction are existent, and we know which metabolite of estrogen is causing you to proliferate into ovarian cysts. So the recommendations on the report came up with 3 recommendations. It said bottle 4. I want to highlight bottle 4. I'm going to highlight some of these. And for those of you that are joining late, we are offering a raffle for our, if you sign up today, we're offering a free raffle to our product selections. Some of the products that I'm recommending in here are going to be some of our hero products. So Formula 4, I can tell you I've been using now for over a year with my patients. This is our star formula. This is the one we're running through the fastest. Formula 4 is an amazing blend. It's probably the best blend I've seen so far. I'm not saying that because I'm a owner in the company. I'm literally telling you my patients are freaking out about Formula 4. There are so many products I could highlight a million, out of the 26, I could tell you which ones, right, are being amazing. I can tell you specifically Formula 4. If you take nothing away, this is a beautiful, beautiful blend. Formula 4 has been changing the PMS game for me and my patients specifically. But what it is it's a complete menstrual blend. So it will kind of balance out all the hormones comprehensively. So it is very, very nice. We are seeing almost no side effects off of it, which is really cool. And it seems to really mitigate a lot of the symptoms with hormonal dysfunction in general. So sometimes it's recommended when you see that it's specifically typically called out for PMS, but in this case, it said we need to harmonize this patient's labs because they're, her levels are a little over the place. Formula 10 was designed to regulate the androgen dominance, right? Because we saw that the serum testosterone in this case was elevated, right? So we want to balance out the androgen response to create healthier ratios within the metabolites to total testosterone. And then there's a restore blend, and this is the most important because this will pull out that nasty 16-OH. It'll bind and pull out the nasty 16-OH that is causing the cellular proliferation of the ovarian cysts. So I was nervous and excited to start her on everything. I was like, okay, we'll see. We're going to put you on these 3 products that are recommended. 1 month after the treatment began, puffiness completely resolved. She started losing weight. Her energy started to increase. Everything was marginal, right? She just started to feel a little bit better, but this is only 1 month after treatment. No change in her cycle length at all. Flow was still heavy, but it was less heavy the rest of the cycle. But the big, big, big win that month is that was the first month she didn't have a cyst rupture. PMS was slightly better, not significantly better, but slightly better. So I said, great, you're on the right path. Let's check in every month, but we'll try it for the next 3 months. We'll see how it's going. 3 months after the treatment began, complete resolution. She lost 7 pounds of weight. A lot of that weight was estrogen dominance, right? So it was a lot of that puffiness that she was experiencing. Everything resolved because that 16-OH was really problematic, and it was also exhausting her, right? So her energy skyrocketed. She lost all the weight. I didn't have to do any of the weight loss stuff. I didn't have to do any of that other stuff that I do. Libido went back to normal. Her cycle shortened in length. Her flow was normal, and PMS completely resolved, and she hadn't had a cyst burst in 3 months. So I was very happy with this case. She was very happy. So let me show you another one. This is Allison. Allison is a 41-year-old female. She came in with something called PMDD. For those of you who understand what that is, it basically means PMS on steroids. It is awful for females. They are incredibly unhappy and depressed. It can last up to 2 full weeks before the period starts. These are going to be your significant PMS cases. It can also really change irregular cycles. These are hard patients to capture on a Dutch test because sometimes they'll have a cycle, sometimes they won't. Sometimes they will create follicle release, sometimes they won't, right? Their periods all over the place and they're miserable. So she came in with PMDD. We did a workup. I did the blood work. I did the Dutch test. Luckily, that month she ovulated. We test for ovulation strips. We give ovulation strips in office and we do basal temperature, right? We correlate the two. I can explain that a little bit more if you guys don't know how to teach your patients how to test for ovulation, but we do test for ovulation. I do blood work and the Dutch test typically on the same day. And then I did a full workup on blood. Everything came back normal. All her hormones came back completely normal. No changes in everything. Everything was completely in the normal range. Functionally, A1C was a little bit high, but not even in the high end of the range. She just took a lot of B12, so that was high, no problems, right? So I ran her Dutch. If you look at the Dutch report, the Van Dials all look relatively within normal. Progesterone's slightly on the lower end. Testosterone's medium mid. Estrogen's medium mid. I was like, okay, no idea. DHEA, for my purposes, functionally a little bit low. If I was just going to look at the Van Dials, testosterone, again, androgens are slightly functionally low, barely, right? If we're being nitpicky, we can say she's a little bit androgen low. Progesterone, one of the progesterone dials was low. Everything else looked okay. Total progesterone was medium to low. Beta progesterone was healthy. Estrogens across the board looked fine, right? So I was like, okay, I don't know 100% what's going on with you. Let's run your endo report. So the endo report, this is pattern 86. It said that she had an ovulatory cycle, but is moderately estrogen dominant due to poor progesterone production. And now this is really important. This correlates the ratios between estrogen to progesterone. So the only way you're going to know this is if you put into a progesterone estrogen calculator and you put in all those numbers yourself. And then you're going to see that relationship, because if you look at the Fan Dials, everything looked normal. So this is really important to figure out, right? She is having poor progesterone production. So we prescribed, the recommendations was 3 supplements. These are some more of our hero products. I'm mentioning them here. Formula 1 is an amazing formulation for low progesterone. We put in all the things that cause an elevation of progesterone themselves. If you want to start, if you're having a female with irregular cycles, and you don't know what else to do, and you think it's progesterone related primarily, Formula 1 has been a big solve for us in that category. It has all the things in there to kind of push follicular health and follicular support for creating healthy progesterone. Formula 12 is an amazing formulation for binding a 4OH. Her 4OH, and I think I forgot to put the findings report, her 4OH was a little bit elevated. If you look at the dial here, and you look at this calculator right here, 4OH was 13%. You don't want it above 11%. So marginally high, right? But can create a lot of the symptoms. I forgot the second slide that explains 4OH. My apologies. 4OH is really important. So 12 is a really important product because 4OH can also cause DNA damage. It's one of the products we recommend for females who have a higher tendency to have breast cancer, because 4OH, if it's too elevated past the ratio, will start to create oxidation effects and destroy DNA. 12 is an amazing formula, and it's one of our hero products for that reason. So a lot of my female patients that I put on HRT, on hormone replacement, I will recommend them to do 12 just to prevent oxidation of 4OH and to keep them happy and healthy while they're taking hormones, because it'll help them support their hormone synthesis, hopefully not creating any DNA damage and ultimately cancer. It is not a for sure thing, but it will reduce, hopefully, the risk of it. right? So, and then 4 again was prescribed because this patient had PMS, PMDD. So this was actually even optional in the report, but I said, no, absolutely no, we need this. But really, it's the progesterone synthesis that we need. It's the binding of 4-OH, and then the overall hormonal synthesis. So 1 month after treatment began, 0 change. I was like, okay, it's probably a little early. We don't know yet. We know what's going on. Give it a little bit of time. I typically recommend 3 months on the products before you kind of see effect. 3 months in, she said everything changed. I hadn't seen her for that second month. I typically do month follow-ups. I had not seen her for month 2. She came in month 3, said all symptoms completely resolved. She was the happiest she's ever been. She said no PMS, complete resolution of PMS and PMDD, cycles completely normalized. Basically, all we did was we promoted the production of her progesterone so that her cycle regulated. And with a healthy progesterone, there's not that crazy irritability in PMDD. So what progesterone does is it feeds glucose to the brain. That's one of the primary functions of progesterone. If you have low glucose into the brain, you will feel miserable, right? It's kind of like being hangry all the time. That's why PMS women get irritable, because it's kind of the same concept as being hangry, but it lasts for as long as that does because there's a lower progesterone amount. It's not always the case for all PMS, but mostly for PMDD, that is the case, that there'll be lower progesterone. So we basically just created herbs. We supported her body. And then after 6 months, I kept her on all the products for 6 months. I typically say be on all the products for 6 months, especially if they're working. And then I put them on their base formula, right? In this case, her base formula was the first formulation in the list, and that's Formula 1, because that just supports healthy progesterone synthesis so that these results don't come back. She was very happy to continue on 1 bottle. And then we checked in 3 months later, everything was great. So super happy, healthy, got her down to a bottle. She was thrilled, right? And we're very happy with it. David was an interesting case because I do a lot of male health as well. David came in and he said that his chief complaint was weight gain, low libido, fatigue. He's waking up tired, tons of brain fog, restless sleep, and persistent body pains. He was seeing another doctor at the time who put him on a medication called Clomid. For those of you who don't know, for men, typically before the age of 50, I do recommend Clomid if they have really, really low testosterone. Clomid is a medication that basically they give to females for pregnancy. So what it is it pushes all the hormones. So it pushes testosterone and estrogen. But then they give men Clomid, and then they give them another medication called anastrozole. Anastrozole will stop the conversion of estrogen. So basically just their testosterone elevates. So for those of you who know, he was on Clomid and anastrozole. He came back. This serum, sorry, it was copied from the last slide. That's not correct. Ignore that. Everything came back normal. I copied in his full lab so you can see everything I ran. So I ran his full gamut. His total testosterone on Clomid was 487. For those of you who do a lot of hormonal work, that to me is a very bad number on Clomid, because that is us pushing his production of testosterone. Before Clomid, his testosterone was 237, which means that he wasn't within even the low end of normal. So he was completely low, right? Everything was, on this. His bioavailable testosterone was healthy. It was 50% of the range. So I was like, okay, even though your total testosterone is kind of normal in the blood, your medium testosterone is 50% of the range. This should be enough for you to feel good. I don't really know why you're not feeling healthy. Let's run your Dutch, see what's going on. So we ran his Dutch, and I looked at his cortisol, had a pretty healthy, beautiful cortisol curve. Estrogen was on the low end, so that means the anastrozole was working to stop the conversion of testosterone. Testosterone was low, right? Bioavailably was low. It was different than what the blood said. And when I looked at the numbers, even though the total testosterone was low, he was still converting a little bit into estrogen. Again, the metabolites are the more important picture to figure out. So what is going on with the story? How is his testosterone breaking down, and what's happening? His 5 beta testosterone was high, but his 5 alpha, which is the dominant testosterone, was healthy. Again, if you don't understand all this, you'll even love our reports even more because they will explain all of this to you. But if you do understand what I'm talking about, then 5 beta was a little bit high. Alpha was relatively normal. I looked at him and I'm like, it doesn't really explain your symptoms. Let's run your report. Let's see what's going on. Sorry, the rest of the estrogens all look normal. Methylation activity was slightly low, but it wasn't even low. It was just tending on the lower end, right? So we ran the report and it said because we entered in the fact that he was on Clomid, it said this pattern reflects hypogonadal activity, right? We know that his gonads are not working healthy. They're not producing enough testosterone. Based on the symptoms of concern, consider addressing androgen health with herbs and minerals to support androgen activity. So what we found out was it was that 5 beta reductase preference that showed that 5 beta metabolite of testosterone had a stronger preference. Now, if you don't know the difference between 5 beta and 5 alpha testosterone, the findings report in the EndoAxis will explain that to you. But a strong 5 beta preference decreases androgenic potential of testosterone. So although 5 alpha was healthy, because he had a 5 beta, basically what that means is 5 beta starts sitting on all the receptor sites of testosterone, and it does not have a potentiation effect. So he's feeling low testosterone, right? And even though if you looked at his labs, testosterone was almost 500, bioavailable was 50%, right? So a conventional doctor is going to say, this guy looks fine. I don't know what else to do, right? It must be something else, right? So the only way you're going to figure that out is if you looked at the Dutch test and then if you understood the ratio between 5 beta and 5 alpha. But this calls it out for you. So and then it'll tell you he reported the use of Clomid, which is cool because if you didn't understand that, you would understand it will call out the drugs that he's using and what's going on with it. So it'll explain what Clomid does and what it's doing to his body, which is even better. So the recommendations on his particular labs came back and it said his methylation activity is low. So what that's going to do is it's going to cause an excess of estrogen, and then it's going to, and he's not detoxifying, so he's going to feel poor methylation. And then 20 is going to support specifically all the tendencies to move back into 5 alpha. And once we lower 5 beta and we elevate 5 alpha, he's going to feel, even with his current use of Clomid, that all of his androgen receptors, his testosterone receptors, are finally working, which is really cool. So 1 month after treatment, he started to improve. Slight improvement, 20% maybe, libido, fatigue, weight loss, no change to body pains. 3 months after treatment began, energy became normal, libido became very healthy. He started to regain function and erection quality. He started to exercise and lose weight. His body pain started to reduce. 6 months after treatment, full resolution. I did not change his protocol at all. I just said, start working out more than you have been, and do all the things that we do. As me as a naturopathic doctor, but as FDNs, all the other stuff that you guys would do, everything with the support. But hormonally, the shift that's happening is that his body is going from 5 beta to 5 alpha. And that is why for some men, people don't run the Dutch, but if they're not responding to conventional therapy, it is the story that's more explicit, right? So I do want to leave a little time for Q&A. Basically, we use FullScript primarily. All our products are on FullScript because 26 products is a lot to carry. So the report itself will say, you upload the report, you upload the symptoms. It'll tell you this is the report. These are your supplement recommendations. In our portal, you'll enter in your patient's email and you'll create a cart for them through FullScript, and you can send it to them or not. It's totally up to you. And I'll show you basically what FullScript houses all our supplements. You can search for them. You can see the description of all of them. You can start to play around. But once you kind of build their cart in the product catalog within EndoAxis, you can send directly to the patient, or you can build their catalog even further. So everything is there. So this is the accounts. I'll leave it here. we can get into some Q&A, but I'll mention one more time the raffle. Yeah, if you sign up today, it's free to sign up. It's free to use our platform. If you sign up today and you type in FDN or the FDN conference or whatever, we monitor all that. I have my staff looking at it. We're going to enter everybody in to win our top hero products. We'll probably do about 5 raffles. So if you enter today, it's all free. You just put in your name and then you'll enter in to win a raffle. And then you'll get a selection of our top hero products with descriptions of when to try these out. And I hope that was exciting for everybody. Thank you so much for having me. And yeah, if we have some time for Q&A, we can get to
Absolutely, we do. We got about 5-6 minutes, no problem. If we could get a thank you for Dr. Guy in the chat, really cool. Just to be clear here, so they're not confused with the QR codes, because obviously we have this one. The creating a free EndoAxis account versus the one that I'm showing, is that fundamentally the same for the sake of the raffle, or is that still different?
I don't know what was in the PowerPoint, so just use the one that's in the bottom.
Okay, we will do that. Awesome. Okay, so we will buff out some questions. I'm just going to the first ones that I see to make this easy. Let me throw this over on the side, actually, and you get to see his wonderful face there. Here we go. Oh, wait, M. Oh my gosh, I haven't seen you all Clinical Summit week, and I swear to God, I was just asking about you 10 minutes ago in our chat. I need your email, my friend, so I can get you on the trainee roundtable in Summer Open House. Thank you for being here, M. You just appeared. I manifested you. All right. Lisa, do we register as FDN even though that says nutritionist?
Yeah, it doesn't matter for our purposes. We just have to qualify everybody. So don't even worry about that. We don't just between us, we don't even care about license numbers. So even if you can type in FDN or nutritionist FDN, it's not going to make any relevance to you. Just we are supporting the providers. We're not a lab. So as long as you have Dutch tests that you're ordering, you can put them into the system. Don't worry about that piece.
Okay, thank you. Shannon, is EndoAxis only available in the United States?
It is right now. We are trying to go global, but that is very challenging for many reasons. But we are hopefully within a year we'll be global. Canada, unfortunately, is not on the list because of the regulations of Canada. Even though we produce all our products in Canada, we cannot sell to Canada based on Canadian policy. I'm sorry, but we are trying to go to the EU. We will be in Australia and New Zealand, I think, within 3 months. And then we're trying to go to the UK and the EU soon.
Guys, make sure to fight for this stuff. I always got to say this because of today's world. I don't mean physically fight, but you fight by voting with your dollars and making your voice heard. It's kind of insane, what certain countries and even certain states in America believe that you have the right or lack thereof to do with your own lab work and data. It's kind of crazy. So I think that would be something that I would hope would be a great political mediator, is that we can all poop in boxes and send it out if we'd like to. But New York State doesn't like that. So kind of crazy. Anyway. All right. This presentation is amazing. Just a bunch of thank yous. This is great. All right. Okay. Here's a fun question from Suzanne. How did you go from system engineers to this stuff with endocrinology?
To be so super honest with you, I grew up, my father was a computer engineer, and then I would build computers as a kid. I was really big into building. I built everything, like erector sets, buildings, all that stuff. I was an architect for a little bit. I just like building stuff. It's just part of my nature. But the body is kind of no different than a computer in a weird way. Every part has its own function and what it does. It's a really in as far as the way your brain thinks as a software engineer and as a computer engineer and as a doctor, it's similar parts of your brain that do that type of work. So it's a weird leap for a lot of people, but actually it kind of makes sense in a weird way. And now the weird part is that I'm now doing software engineering with medicine. So I think somebody painted out my life path well before I was born. Yeah.
All right, we'll get another one or two here if we can. Jill, when the recommendations give the formulas and also recommend HRT, hormone replacement therapy, do you take the formulas and get HRT?
Yes. Oh, and this is a big shout out. My sister is a medical doctor who's licensed in every single state. She is supporting all the FDNs who want to do HRT. If you cannot do HRT, you set up a provider link with her. You can still manage your patients, do all the things that you want to do with your patients. She will not intervene. She will just do the hormone replacement part. You can still do everything that you want to do. We should put her link in because there are a lot of FDNs using her now, and they're very happy that somebody's not overstepping. I will put that into the private chat. It's hormone-rx.com. If you want my sister to help you and your patients get on HRT, our system will indicate when HRT is necessary.
What a amazing domain to own. Very nice job. If I'm just impressed at that as someone who likes the marketing and web stuff. All right, let's get one more here. This seems like a nice nerdy one, Catherine. Thanks. Thank you. How do you space your testing frequency, TSH, T3, etc., when you put people on these supplements?
So thyroid specifically, we're not handling yet, is the report. I typically, if I'm modifying thyroid, I do it every 6 weeks. A lot of people do every 8 weeks. I like 6 just because it's a little bit more frequent, and then I can kind of see how their thyroid's doing. But I like blood testing about every 6 weeks to kind of check in, especially if I'm doing hormonal stuff. I like that. Or every other, if it's female hormones, then it's every 2 periods. So 6 to 8 weeks is about the average.
Fantastic. All right. And then we are right at the hour. So just out of respect for the next speaker, Dr. Guy, thank you so much. I'm being serious. I never just say nice things for the sake of it. I have never ran a Dutch as an FDN. I've sometimes used that to my appeal just to let FDNs know that you can start with the salivary testing and then you can learn about this stuff in the future. But this is too dang interesting. So I think you finally got me on this one. I've been running some tests anyway, so now I really want to know. I see a bunch of other people are clearly going to be entering the raffle. We had over 21 people so far scan that QR code, and that doesn't count the people that might watch a little bit later. So I will pull you off here. But again, thank you so much for being a part of this.
It's really nice to see everybody. All right, guys. Bye-bye.